Welcome back to Talk 1260 KTRC, the Humanity Behind the Vanity. I'm Dr. Daniel Ronel, here with my wife Betsy. We just heard from Dr. Rita Dodge about eating small portions. But before that, we talked about ways to eliminate fat.
Yes.
And I wanted to give you my contact information. If you have any questions, you can call 988-8886. You can stop by 444 St. Michael's Drive across from the hospital. Or please go to the website, DanielRonelMD.com.
He's also on Facebook and Twitter.
Facebook and Twitter, and we always have promotions going on for those things.
Right, in the media, so.
Yes, so look those up.
Right, check it out. Alright, so now we're going to talk about something that you already do. It's always nice to be validated when you see it coming up in the masses. This isn't really the masses, but I get Yoga Journal. So in the current issue of Yoga Journal, the October issue, they have a great article on the heart of healing. And it says, prepare for surgery with the mind-body techniques that may help you recover faster. Obviously, Daniel and I already know about this, but it's just nice because here he knows what he does, and we'll talk about what he does for those of you who don't know.
Yeah.
But here they talk about some really great things. You know, and
they have what do they have in there?
They have. Hold on, Chief. Okay. They have, something that's called personal power. And so within the personal power, you can do, it's just harnessing the power that you actually have, which most of us don't even realize we can do or have, or we just don't think we have the mind for it. It just takes a minute. So one of those things, personal power, is focused breathing, diaphragmatic breathing, belly breathing. So you breathe deeply into the lungs and expand the diaphragm. And it does. It makes a huge difference in the oxygenation and in relieving the anxiety. I do this a lot. I taught my kids to do it.
Is this something that you would do before surgery?
Exactly.
Okay.
Anytime you're feeling, anxious, you do it. And you might do it before you get your meds to knock you out and, drug you up.
Mm-hmm.
And this could be anything. I mean, there are people that dread going to the dentist. A simple thing like that, they have teeth falling out because they're terrified of the dentist, and it's a legitimate thing, or they hate getting a checkup, or they're scared to get their blood drawn. This is really very common. So this is for the average person, any of us. This is for the average Joe or Jane. Focused breathing. Breathe into your belly and breathe out. And that really calms your heart rate down. Also guided imagery.
Yeah. Very important.
Visualize things. Visualize health. Visualize a scene that relaxes you. Like I even wrote on Facebook the other day. I said and it was strange. The one thing, 'cause I was surprised this happened, I was trying to relax during something, and I was relaxed. I was very relaxed, and I had realized after what I was thinking about. It was my crazy dogs. I just love them, and I was just thinking about their smiles and their little goofiness and, all their little individual things that they do and their quirks, and I was completely relaxed. Anyway, so that was a guided imagery visualization, and, visualize to materialize. There's an expression. That doesn't mean you're going to go get your Gucci bag. That means I'm going to visualize myself relaxed, at peace, on the sea, with the sun on me, whatever it is, under a tree with the leaves blowing.
And before surgery, it's important. It's great, not just plastic surgery, but if you
anything,
gallbladder, hip removed, whatever, you visualize.
Even getting your blood drawn.
Right. You can ask your doctor to help you visualize certain things, like blood flow going in the right place, or the bone being set in the right way. Visualizing those things really helps.
It really does. I mean, there's such a mind-body connection, and people have known this for centuries, but little America here is just catching on.
I have a patient just today. I just saw her today. She's 2 weeks post-op. She had a breast augmentation, and then she had a revision, and she picked a size that I told her she may not be happy with, and she wanted certain things done to the areola that I just told her, I don't know that you're going to be happy with it. And she kept the whole time saying, this is going to be fantastic, I know it's going to be great. And she was almost trying to convince me. And then today she said, see, I told you.
Good for her.
And they look very good.
Well, it's excellent.
Yeah, and that was really her doing.
Yeah, I mean, you're not downplaying the positive results you may have, but you're just saying, it's not always perfect. You just don't know what you're going to get.
And today, also today, I did a breast augmentation on a woman who was very, very, very nervous.
Aww.
She's been nervous the whole week, and we've counseled her.
I get nervous.
Yeah, we've talked to her on the phone a couple times a day all week, and then today she was very nervous. And the operation went well, and she looks fantastic. And she woke up in pain which is sort of unusual, and I think it's because
she was so wound up.
She was
Yeah.
so wound up. It was really
Has to
hard
be.
just to get that edge off of her. Eventually we did, but it.
Well, that
I did
happened
3
to me.
cases today, and the other 2 were fine because they really weren't that nervous.
Right.
And this one, there was nothing different in the medicines we used and the techniques we used.
Right, she had
just
worked
woke
herself up.
She just worked herself up.
That happened to me though. Remember when you did liposuction on my legs?
Yeah.
I had to stay in the hospital overnight because one of my legs, I could not move it or...
Couldn't relax it.
Right.
It was all tensed up.
Exactly, and I was so anxious. None of this worked. I tried the breathing, I tried the guide, I know all about all this stuff. Didn't work. I was so nervous. Because for some reason for me, serious liposuction was like the one thing I was scared of. I don't know why. I had seen all these stupid shows on it and they made me scared. Really now I'm like, ugh, it's nothing. But I remember that. I put myself in the hospital overnight because I was so anxious.
That's right.
It's really true.
And then you were hiking 3 days later. So.
Right, I was. I got over it very quickly. And I was hiking 3 days later, which no one should do. I can do that because I live with the doctor.
Oh,
and,
it's okay.
you
With
know.
the new techniques you can do.
Alright, this was the old school.
Okay, what else?
Knocked out, sucked out, you know. Okay. Affirmations and mantras. Those are really wonderful. I say them when I get very angry with certain people. And
The anesthesiologists often
Really?
are asked to whisper into the ears of the patient who's asleep. Everything is
Oh, that's
going well.
cute.
You're going to wake up without nausea. Yeah, when we had Dr. Garson on, he talked about that.
oh, that's sweet.
And
we should have one again.
yeah,
Yeah.
yeah. So that it works even when you're unconscious.
Oh, how sweet.
Yeah.
I love the care you get when you're trusting yourself to a good doctor. I love it. Anyway, okay, so affirmations and mantras, they can be anything. And they don't have to be, you know, from the Hindu tradition. They don't have to be from the Bhagavad Gita. I mean, they can be, you know, as simple as, you're doing great, your breathing is wonderful, you're going to have a great outcome. I mean, it can be just basic.
Right.
Relax, you're sleeping
Right.
peacefully, whatever.
Sometimes people need a guide. That's why we have the aromatherapist who
Right.
can really
Yeah,
guide
let's
you
talk about
with
what
that.
you do with this stuff. You take it to a different level.
Yeah, because this is hard to do.
It's very hard to do.
It's really scary, and so we have people
But it can be
who...
done, people.
Yeah.
Even if you doubt you can do it, I bet you can. I challenge you.
Okay.
1 minute of some positive affirmations, focused breathing, guided imagery, anything. It's in your car. You're getting angry at this jerk in front of you. Say some mantras. You know, I don't know. That's what I do. I get mad on them roads. All right.
When you need a guide, you can come and see our aromatherapist
Yeah,
who
Chris
really
Reed.
helps with potions and lotions and things that, you know,
She's
when you
awesome.
breathe in, it puts you into the right mindset. We also have a reflexologist that also helps in that way. It helps with the guided imagery. So
You have a
we don't-
craniosacral person?
We do. We're just starting to use a craniosacral person who also does polarity therapy, Lisa Bauer.
I haven't done that yet. I want to do it.
Okay.
Yeah.
Our producer is telling us to wrap up.
I'm a big believer in the aromatherapy business and the breathing. That's what works for me.
Yeah.
So does sometimes affirmations and mantras.
You can find out a lot about this on the website, danielronelmd.com, and we'll talk about it again.
And you know what? If I can do it, believe me, anyone can do it because I am as whacked out and distracted as anybody.
Okay, thanks
All
for
right.
listening. We'll see you next week.
Bye.